Why does liver disease cause intense itching? Intense itching, known as pruritus, is a common symptom in liver disease, particularly when bile flow is impaired. This condition is often associated with cholestasis, where bile cannot flow properly. The reasons behind this itching are complex and not fully understood, but several factors play a role. One major factor is the accumulation of bile salts in the bloodstream. Normally, bile salts help digest fats, but when the liver is not functioning well, these salts can build up. When bile salts deposit in the skin, they can trigger itch receptors, leading to that uncomfortable sensation. Interestingly, not everyone with high bile salt levels experiences itching, and the severity of itching does not always match the bile salt concentration. Another contributor is elevated bilirubin levels. Bilirubin is a pigment that results from the breakdown of red blood cells and is usually processed by the liver. In liver disease, bilirubin levels can rise, which some studies suggest may stimulate nerve endings in the skin that transmit itch sensations. Additionally, other biochemical mediators in the body can influence itching. Histamine, a compound involved in allergic reactions, can be elevated in liver disease, but higher histamine levels do not always mean worse itching. Endogenous opioids, which are natural pain relievers, may also paradoxically cause itching by interacting with receptors in the nervous system. Furthermore, lysophosphatidic acid and its enzyme autotaxin have been linked to itch severity in patients with cholestasis. The process of itching involves various receptors and signaling pathways in the skin and nervous system. These include histamine receptors, serotonin receptors, and transient receptor potential channels. Immune cells and skin cells also contribute by releasing substances that can worsen itching and inflammation. Clinically, itching often affects the palms and soles but can be widespread. It tends to be worse at night, impacting sleep and quality of life. Interestingly, the intensity of itching does not always correlate with the severity of liver disease. Some individuals with mild liver dysfunction may experience severe itching, while others with more advanced disease may not. Managing this symptom is crucial, especially for those with cholestatic liver diseases like primary biliary cholangitis and primary sclerosing cholangitis. Healthcare providers should actively ask about itching symptoms. Treatment options may include moisturizing the skin, avoiding irritants, and medications that target the underlying issues, such as bile acid sequestrants and opioid receptor antagonists. In summary, intense itching in liver disease arises from a mix of biochemical changes due to impaired bile flow, the buildup of substances like bile salts and bilirubin, and complex interactions within the nervous and immune systems. This symptom reflects the broader effects of liver dysfunction and requires careful assessment and management to enhance patient well-being. Always consult with healthcare professionals for personalized advice and treatment options.